Hello everyone. In the previous video, I have discussed with you regarding why do we have to replace the missing teeth? What are the reasons for replacing the missing teeth? And what are the issues which you may come across when you don't get your teeth replaced? In the today's video, I will introduce to you the various options which are available for replacing the missing teeth from a single tooth replacement to the multiple teeth replacement. Now, there are a lot of options which are available, but before that you should understand that teeth are important, and a healthy set of teeth not only helps you to show off a fantastic smile but also helps you to maintain a overall good health. The absence of a tooth or multiple teeth can make your common task like chewing or speaking also much difficult. It not only affects into your local actions, but also local means in relation to your mouth, but also it also affects your systemic health, means the overall medical health is also affected. Now, when we move on to the option number one for the tooth replacement is the dental implant. You all would have heard about dental implant. You know what a dental implant is. It's nothing but a metallic screw which is kept inside your jawbone, which is actually replacing the root of your tooth. It basically replaces the natural tooth root and inserted into your jawbone, which actually supports the overlying the replacement crown or a bridge or a denture. It is one of the best options for the people who are having missing single tooth or maybe more teeth which are lost because of various reasons. Could be a gum disease, could be a decay, or could be any other injury also. Now, what are the benefits of an implant? An implant, the most important benefit is the success rate, which is almost more than 95%. It is a very durable and a permanent treatment option with a very minimal maintenance, and the most important thing, you feel natural and comfortable with it. The most, I can say, the biggest advantage of an implant, dental implant, is the teeth adjacent to the implant or the teeth adjacent to fill the gap are not modified, are not touched at all. But the only disadvantage of a dental implant is the treatment takes little longer time sometimes, little expensive compared to the other treatment replacement options, and the treatment includes one surgical procedure which is definitely needed to insert an implant, but which is not very invasive. It is a I can say that it is easily and very comfortably done for the patient, and it is only one surgical procedure which is needed at the beginning when we insert an implant, but otherwise it is absolute durable and a permanent option for replacing the tooth. When, when do you choose an implant over other options? What are the varieties of implants? What are the varieties of restorative options? I will discuss in my next video, which should be exclusively on dental implant. The next commonest option which people prefer is using a fixed bridge. You all have heard of a fixed bridge, or which is called as a fixed partial denture or a tooth supported bridge. It's a very common alternative to an implant. And the most important thing is it consists of two crowns, as you can see in the figure. It consists of two crowns which are normally fitted onto your existing teeth, and one crown which is the missing tooth. That means the missing tooth crown is called as a pontic, and the two adjacent crown which you are seeing, which are like caps on your adjacent tooth, is called as an abutment. Now, when you need to know that the benefit of this type of fixed bridges is it feels like natural. Procedure is very straightforward, and treatment is normally just take two weeks max to complete your treatment. Maintenance is also very easy. You can brush and floss as your regular teeth. Cost effective method, and the treatment is relatively at a very low risk when you consider the medical health. But the disadvantage is the most important, as you all know. You have to grind, or you have to make your adjacent to natural good teeth little more modified, or make them grind them. We have to grind them, we have to make them little shorter so that the overlying crown can fit onto it. So grinding down the adjacent tooth will increase the risk of the teeth, the abutment teeth, to get decayed or sensitivity or infected in the future. That is one thing. Second most important thing is the patient have to thoroughly clean underneath the pontic, underneath the artificial bridge. You have to thoroughly clean it because there are chances of foot trapping, and that can lead to other issues. The most important thing is does not provide any stimulation to the bone underneath the bridge. Okay, so that is where you have to decide what type of treatment option you prefer when you want a single. That means the decision of whether you want to go for a dental bridge or a dental implant is up to you, and you have to consult your dentist regarding what would be the best. Implant is always preferable, but as you know, every treatment has got its own pros and cons, and every patient has got, few patients have got their own indications and contraindications whether that can be done or no. It is not necessary that every single tooth which is missing can be replaced by implant only. There are some situations where implant is contraindicated. So you need to consult a dentist, but you need to understand that there's always an option, and consider always an option of a dental implant over a bridge if the option is indicated for you. Then the next most important option which people prefer is a resin retained bridge. Maybe you would have heard of a resin bonded bridge or a resin retained bridge. If you see, this is sometimes called as a Maryland bridge. It is basically used or maybe to replace the front teeth. This is because it is relatively very fragile and it's unable to withstand the chewing process which are created by the back teeth. If you see in the figure, it consists of two wings that are attached to the abutment tooth or adjacent tooth on the what do I say, the surface which is behind, which is not seen, on the surface which is nearest to your tongue. The wings are attached to replace the existing tooth. Like you, as you see in the fixed bridge, you have a tooth and you have a two small crowns. This is not crown. It is like a two wings, metallic wings which are attached behind, which is not seen definitely. So the abutment teeth must be healthy and strong. And what we do is we slightly grind them, slightly grind your adjacent teeth on the inner surface and try to etch it. Means try to stick on these two wings onto that. The major benefit, it is cheaper and less invasive. There's no much harm. You don't grind overall tooth, you just grind the inside surface of the tooth. That also partly. Okay. It restores your ability to smile and to eat or speak. It provides support to your lips. See, basically, you need to understand, when do you prefer a resin retained bridge? You prefer a resin retained bridge when you want to go for a fixed bridge or you want to go for an implant, but you need the time to think about it, or you have done a tooth extraction and there's a healing period of 3 to 4 weeks, as your dentist says that you need to wait for a month or 15 days for that. So during healing period, it's a front tooth, it looks bad cosmetically, you need a temporary solution so that you can go to your work the next day, and so you can prefer a resin retained bridge which is given for a few days or few weeks, and then once your healing happens completely, it is done, then we remove it and then we go for the further treatment, whether you want implant or you want a fixed bridge. The disadvantage, as you know, it is not very strong. Okay, and it is, you cannot have very hard food, you cannot bite any hard food because there is always the chances of popping off of your teeth or your denture. Okay, relatively multiple times you need to visit for recementation, and it is very fragile, so it is never an option for a long term benefit for any patient. That you have to understand. Then you have a removable partial denture. That means a removable denture. This is designed to replace a single tooth, double teeth, multiple teeth, missing teeth, same arch and opposite arch. Now this basically contains, it is nothing but like a denture. It has got an acrylic plate which you can see as a pink colored plate. And you have got a number of teeth which are missing. Those teeth are replaced, and you can see a two small metallic clasp, which is metallic retainer, so that your denture is retained into your mouth. Okay, they are called as a metal clasp that will fit over your existing teeth, holding your denture firmly into place but still allowing it to be easily removed. So you should be able to remove it and replace it back of your own. Okay, so that you have to understand. The best benefit is less expensive when compared to anything in all the replacement options. Very effective at filling gaps between the teeth, restoring your missing teeth, but sometimes you may have to have additional teeth which are there. If you want to add up some additional teeth, you can add up to the denture later. Relatively very quick and non-invasive method it is. You have got, but one more option or one more alternative for a removable partial denture is a flexible denture. There is a flexible denture, that means the dentures are of different material, they have chances of being flexibility. The previous one which I mentioned you is a acrylic, they both are acrylic metal, but that's hard enough that you can't flex it. But this is more flexible, little expensive compared to the regular dentures. But the only disadvantage of these removable dentures being You, whether these are uncomfortable, definitely. Sometimes it's unstable, may not look very natural, may not function as natural teeth, that means fixed teeth. Okay, you need to remove them every day. You need to thoroughly clean them. You need to leave it outside overnight. Allow the gums a chance to recover. Replace it back in the morning, and that is the only thing. You may have to undergo relining of it quite frequently, so you need to understand those things. So it is little fragile, easily broken sometimes, but the only thing is it is cheap and effective way when multiple teeth are missing. But you should be able to decide and come to a decision whether you want to prefer a removable denture or a fixed denture, but that's always in an option. The same removable denture, when it is of a complete complement of teeth replacement, which is called as a complete denture. Okay, a complete denture which will rest on the top of your jaws or your gums at a very low cost and non-invasive method or a replacement to a dental implant treatment. Again, the same thing. It consists of an acrylic, which is a gum colored base, pink colored, which matches with your gum color, to which the denture teeth are attached. Okay, this is called as a complete denture. It significantly improve your appearance, may help to increase your self-confidence because all your teeth are replaced at a moment, provides correct support to your muscles of cheek, your lip, your restores your facial dimensions, okay, and can improve your speech, can improve your what do I say, your mastication. You can eat properly, comfortably, gives you a little natural because the teeth are also selected based upon your appearance and your shade, your size, everything. You have an option to it. But again, the same thing, the, the cons of this, it can become ill-fitting within a very short period of time sometimes for some people because the jaw changes can happen. Not possible to eat very hard and very sticky substances. Again, the same thing as I mentioned you regarding removable denture. You need to remove them in the night, overnight. You have to leave it outside. You need to keep it in a glass of water. You need to maintain it. Next day you have to clean it, wear it, and all those things are there. So it may definitely affect sometimes your ability to taste the food. Okay, and sometimes it may rub on your gums or your inside of your lip. You may sometimes become, it can become sometimes little painful, little ulcerative, which is called as sore spots. If you retain it long into your mouth, you may get some fungal infection inside, and sometimes you may get that the denture is got, but then you are feeling uncomfortable, it is slightly loose. Then you have an option of a denture adhesives which are there, but they are often little messy and they're not indicated for a long term solution for that. Okay, and you may make a clicking sound when you speak sometimes, which may be, as I say, embarrassing in social situations. So but these are the cheapest and a cost-effective way to replace full complement of teeth for few patients, which is called as complete denture. You may have to visit your dentist for 2 or 3 visits, and half of the procedures are done in your clinic itself, and half of them are done to the laboratory work. And then you need to visit, and you have to sustain with all the protocol of using it, and then try to get adapted to the complete denture. Then you have one option which is called as a temporary denture. Temporary dentures are very commonly called as the flippers because they flip in and out easily. Okay, they are also sometimes used in future with a bridge or an implant, but we are waiting for the site to heal, as I mentioned you, for resin bonded also. So sometimes when you want to go for a long term bridge, or sometimes you also have an option. This is also very inexpensive. They are fabricated prior to the tooth extraction and fitted right after the natural tooth is replaced, an immediate solution to the denture. Okay, and that is, but the disadvantage, again the same thing, it's not very strong, not very stable, fragile, and that's all. So even the tooth what we replace is also a flipper tooth, very less bulky, less sturdy, and we, the only advantage is we do not alter your surrounding teeth. So resin bonded bridges are fixed option for replacing. Flippers are removable option for replacing a single tooth. In immediate, you extract it, 5 minutes, you give it off. So that, and that's, this is also the same gum colored acrylic, but it is a temporary. It is not a very hard acrylic, and it is softer, fragile, and you have to use it temporarily, and then you can go ahead with your permanent treatment options, whatever indicated. So if you lose a tooth, do not panic. Okay, there are a variety of replacement options available. So you have to consult your dentist to determine the right solution that will keep you smiling and healthy always. So you can visit my clinic, which is Dental Dontics Family Smile Care Center at Himayatnagar, Hyderabad, in case of any treatment options or any advice which you need. Thank you so much.